I'm Dr. Dipesh Batra. I am a neuro and spine surgeon.
And sir, how you feel about the present hospital and healthcare system in India?
So, if I talk about India, India being a very huge country with the second largest population all around the world, so we are being one of the countries who are doing medical tourism at a very large scale. But once I talk about the overall healthcare scenario,
Right.
so that scenario is totally different when I talk about rural India and urban India, and when I talk about the private sector and the government sector.
Right.
Most of the people are living in rural India,
Mm-hmm.
and they are from, I can say that, middle or poor background
Mm-hmm.
financially.
Right.
So those people are not aware about the health, about the implication of the disease, about the financial aspect. Sometime काफ़ी डर जाते हैं. They are feared of कि how much we have to pay, how much the expenses will be.
Right.
I'm not comparing our healthcare system with any other country. Like if I talk about UK or any other country like USA, they have a insurance based system. People just go to hospital. They need not to show any card. They just have their ID.
Right.
So they just put in the system and the treatment gets started.
Right.
They are never asked the cost of the treatment, what kind of the treatment will be, and the treatment is given.
Right.
In my country, the scenario is totally different. If I talk about the Punjab, the scenario in the government hospital and the government sector is not up to the mark, which is required.
Right.
Because person is a person, चाहे वो अमीर है चाहे गरीब है, जान सब दी same है.
हाँ जी.
So it is not about कि one person is going to and moving to the private hospital and being treated, and the other person is lying in the government hospital.
Right.
We are having lack of staff,
Right.
lack of doctors, lack of super specialists in the government hospitals. If you go and check, if we have like 10 super specialty centers, there are almost negligible super specialists.
Right.
Even if we have one doctor cannot do emergency for 365 days in a year. Right? So I mainly treat with emergency cases. I treat with stroke, that we call it as brain attack. I treat with accident. I treat with deal with brain trauma, spine trauma. So you need a person who can definitely take care of. And for us, we need infrastructure that is right from the MRI, right from the CT scan, ambulance services, blue line ambulance, where you need not to stop on any signal. So that kind of system is required if you really want to save the lives.
Right. So, what major challenges, if you want to brief some of the challenges, what major challenges patients face in the healthcare sector?
First of all, even if the patient is insured, even if they are insured, they don't know where to go, whom to meet, how to approach.
Right.
Again, then they send the patient's detail to the insurance company, and it may kill time. In my trade, we talk always about time is brain, time is life. So even if you save around 1 to 2 minutes of a patient, the treatment should not be delayed. We can save lives.
Right.
So to me, every life is important, irrespective of from which culture they come or from what kind of background they are coming. So they should be treated as same as in the private sector,
Right.
if we are talking about the government sector. So we need good infrastructure, good super specialist doctors round the clock, good paramedical staff. If I talk about nursing staff, they should be trained. They should be trained in a centralized center. It is not a nurse has been trained from a private hospital, then she is only working in a private hospital. Because the kind and type of the patients we receive day to day, they are same. Either you work anywhere, and they require treatment. Just being a doctor in Punjab, the patient if goes to the government sector, they are just referring the patient to PGI or some other sector or the private sector. It should not be like that.
If we are entering 2026, and or what changes you expect in this healthcare system in 2026 or in coming years?
So sir, if you talk me about what kind of change, so ਮੈਨੂੰ ਤਾਂ ਇਹ ਲੱਗਦਾ ਕਿ ਸਾਰੇ ਹੈਲਥ ਕੇਅਰ ਸਿਸਟਮ ਬਦਲਣ ਵਾਲਾ ਹੈਗਾ, right from the bottom to the top. Everything needs to be changed because it is being 75 plus years we are independent, but I don't think so the healthcare system has been changed. I started my MBBS in 2003, and since then I have not seen major changes. Even in my hospital, I was graduated from Rajendra Hospital. So even if I go there like once or twice in a year, I can see, yeah, there are some changes they have done, but I don't think so those changes are up to the mark which can actually helping the patients. We are lacking in everywhere, in infrastructure, in maternity, even in trauma. So we need good trauma centers, good neuro centers, good mother and child care centers. So the important lives need some treatment.